Join Dr. Daniel Angerbauer as he breaks down the main types of probiotics, who benefits most from them, and how to choose the best sources of probiotics through food and supplements.
So I guess the best place to start for that is in my head, there's really three different categories of probiotics. And there's really more, but these are the main ones. So the first one that has been clinically available that probably everybody has tried at some point in their life are the lacto and bifido species. So those are the ones that are most commonly available. That's what, the strain will start with, Lactobacillus rhamnosus GG or whatever it may be. That's one. Generally, the dose for those is 1 to 50 billion per day, sometimes even more in some specific conditions. And sometimes people do better with less, actually. So hard to say, but that's a pretty big range in terms of dosing for those. So that's kind of one category of probiotics. Another is slightly newer. These are what are thought of as the soil based or the spore forming probiotics. So they are occupy a slightly different kind of niche in the gut. And the dose for those is anywhere from like 2 to 6 billion. And the third category is really this probiotic yeast called Saccharomyces. And the dose for Saccharomyces is more in the 10 to 15 billion range. So if you're going to do something, and there are some others, like now there's a probiotic called Akkermansia that's out, and I guess it doesn't really fit into any of those categories. And there's probably no, there are others, but those are the main ones that are available that people are taking. The way that I think about it in terms of who should consider taking a probiotic and who shouldn't, I think from what we talked about before, if someone is having some GI symptoms and could be as simple as constipation, which is a very common one, I think it's generally a low risk thing to take. I mean, that's why they're over the counter and quote generally regarded as safe. So a trial is maybe not a bad idea, but be aware that in some patients, a probiotic can actually make them worse, especially if they're more in the small intestinal bacterial overgrowth camp. The other thing to be aware of is probiotics generally their effects peak at around 2 or even 3 months. So you can't just take these for 4 days and then say, "Oh, it didn't work," and discontinue. Now, that being said, you are going to have some sort of beneficial effect in the first month if you're going to have an effect. So it's not like you take it for a month, you feel nothing, and then magically at 2 months, you get like this huge effect. So generally, what I tell patients is take it for a month. If you haven't felt any symptomatic improvement, then we just can discontinue it. If you're starting to have some improvement, then let's continue for at least 3 months and see if that improvement even gets better. So that's one thing to think about. Um, the other thing is which one of those is best in what situation? That's a more nuanced question and is probably best for a provider to answer. There's just too many variables to give a guideline for what fits where. But the other thing that's helpful, we're kind of talking about probiotics as supplements. Always my motto is always food first. And generally speaking, we have consumed fermented foods as humans for a long, long time. And there's lots of research showing that, fermented foods are beneficial for the gut microbiome. There was a study published, I think just this year, that was using NHANES data, which is called the National Health and Examination Survey. And the reason that I spell out that funny acronym is because the examination part is actually pretty cool. Because what you have is you have researchers that go around to the research subjects in person. They can do a physical exam. In this context, they actually did cognitive testing at different intervals. They can also collect blood. And so it's just a really rich data set. It is observational, so there's limitations there. But anyways, this was a study just published this year based off of that NHANES data, and it showed they looked specifically at dairy products, but no surprise, those people that had a low to moderate consumption of fermented dairies, so basically yogurt or kefir, they had improved cognitive scores. So again, it's an association, but the data on that around GI health is, I think, quite strong. And in general, even if you look at randomized clinical trials for early Alzheimer's or mild cognitive impairment, whether that's a supplementing with a food or a probiotic supplement, I would say in general, the results lean positive. It's not a slam dunk. We need more data. We still don't know the right dose. We don't know the right strains. Um, but in general, it seems to be positive. One of these studies showed that the control group, who did not have any cognitive issues and no GI issues, their benefit was minimal to none. Those with MCI or early Alzheimer's, they're the ones that seem to benefit the most. And there's probably some sort of microbiome disruption in those states. So it seems probably better, at least from a supplemental side, as a treatment versus, take this from age 40 onwards. There's just not that much data there, but there, I think, is data in terms of probiotic foods that's going to be beneficial for you. I kind of have a bit of a hierarchy where I think the fermented veggies are probably the most beneficial. So that's your kimchi, sauerkraut, pickles, but they cannot be pickled in vinegar. So the vinegar kills the beneficial probiotics. So these are pickles. They're actually not easy to find, but they're always going to be in the refrigerated section. And if you look on the ingredients at the back, they're going to be pickled in water or a brine, basically water and salt. Second, I would probably then go towards your yogurt, kefir, and yeah, grass fed is probably slightly better. The fat content is better. People go back and forth a lot on should you do full fat or should you do low fat. And I think the data is probably slightly stronger for low fat, just especially in E4 carriers who are more sensitive to saturated fat. But it's not something that I think is a huge deal if you're, having a serving a few times a week and hopefully getting more of your probiotics from the fermented veggie side. And then you have things like, and I guess I'd maybe put in those other categories, you have fermented soy as well. So blanking on the name, tempeh and miso are two of the most common ones. Then I would say maybe at the bottom is your kombucha, which is beneficial, but often comes with a fair amount of sugar as well. And I should have said with the yogurt, low sugar is ideally you're just getting plain, and then you can add some whole fruit on top. For general health, I think one a day is a good goal. Occasionally, where I'll start with people that are having GI issues is let's try and hit 2 of those servings a day, or start with 1, then go up to 2, then go up to 3. And I should say with all of these things, you always want to start slow and escalate over time. Um, and just see what kind of movement they can get up to even like 3 servings of fermented foods a day. And like I said, sometimes that is quite challenging for people. And although food is best, in some cases, just from a practical perspective, maybe it's easier to take a probiotic supplement, but food always seems to be better.
We hope you enjoyed this video. To access a free Mastering Brain Health course led by Dr. Richard Isaacson, visit ind.org/learn. And to directly contribute to IND's research efforts, visit ind.org/donate.